Hi, and welcome to a sort of test edition of the TPS Tech Talk. Happy to have with us an awesome group that took some time out of their day to join in this this test event. Keith Patterson from MSU Denver, Mary Johnson is, I'm assuming, down in Colorado Springs, though she can be found all over the world. Are you in the Springs now, Mary?
I am, finally.
Kathy McGuigan, thank you for joining from the library in DC, and Cindy Stout. Cindy, I'm assuming you're home too, but you're another one that can be elusive.
No, I'm home as well.
So I'm going to actually turn it straight over to Keith and let him discuss a little bit about his thinking for the proposed topic for this week, and we'll just kind of take the conversation from there. The proposed sort of discussion is going to sort of look at exploring public health around technology and primary sources, sort of a then and now approach. So Keith, what was your thinking here?
Yeah, so as we mentioned, this is kind of an idea we had of kind of exploring some more conversational looks into some primary source topics and technology. And one of the things that's kind of was buzzing around of topics we could talk about, obviously Ebola has been hitting the news quite a bit, and I was reading through my feeds one day, and I actually ran across, so I'll go ahead and put it up on the screen here. So we ran across this some stuff on the CDC site that has some different things, some, I don't know if you call it propaganda, public informational sheets. This particular one, talking to some just general safety stuff about, you know, public health and safety with people with Ebola, and the graphics are interesting. You see like the workers and their protective gear, and talking about how close or far, but just some general public safety information. And
I like that there's strength in unity, but isn't getting a bunch of people together when it seems counterintuitive. Make this big joining of people. Wait, there's a disease floating around.
Yeah, but it does say to stay 1 meter apart.
Oh, does it? Okay, yes. I read the headline.
Yes, maybe
unity may not be good in this case.
But really what it came down to is I was thinking, you know, there's a lot of correlation to the WPA posters, kind of a ringer for one of our people, you know, going back to some of this stuff from the WPA project. This is a favorite that we use quite a bit, the tuberculosis in a "Don't Kiss Me, Baby" picture, which is quite telling. I'm gonna blow this up a little bit. Which is very interesting about these use of posters in public health, and I thought it was an interesting kind of comparison over time kind of thing. I also had, thinking back, I was having a conversation with, I was visiting some family this weekend, and one of my I guess we'll call her Grandma Joan, as a retired nurse, and so we were talking a little bit about this Ebola thing, and she was talking a little bit about, she's seeing the kind of the reaction to the Ebola epidemic to early on in the AIDS epidemic, when not a lot was known, and there needed to be a lot of public information about AIDS. And I found these interesting. These are actually coming from the U.S. National Library on Medicine, but some very interesting graphical representations of. But you know, you think back, and the sort of public health stuff that needed to go on to let people know about this incredibly deadly disease, and what was okay and what wasn't okay. And again, so just as a topic and kind of exploring that, I think I'll kind of open it up to everybody, and we can, you know, take a look at anything and just see where it goes from here. I know you all have great ideas, so.
Were you able to find anything on the Spanish influenza? Any posters?
I didn't look, but that'd be an interesting place to go. This just kind of threw out some ideas into some conversations, but yeah, I know there's some good resources at the Library of Congress for that one.
Yeah, I was going to say the thing that I can offer is that I know the National Endowment for the Humanities, who funds Chronicling America, they are trying to do a teacher program this coming summer for 2015 on this the Spanish flu. So I think you'll be able to find some resources in Chronicling America, but I can also check with Meg Steele, and I know that she was part of the initial planning part of the meeting. I don't know if they've pulled together any kinds of resources, but I can certainly track that down for you.
Well, I found some things on Chronicling America this summer when I was at the STEM STEAM conference relating to tuberculosis.
Oh, great.
Was the topic I was working on.
There you go.
But I love this, making it much larger and looking at public health over time, and how these things get portrayed. I would start even wondering if you could find some things from smallpox epidemic in Philadelphia in the colonial era, because smallpox is like the 18th century, TB is the 19th century, AIDS is 20th century, and I guess Ebola might be the 21st century. Who knows?
Let's hope not, but it might be that way.
Actually, it might be a good thing if it is, because it seems that we maybe have a handle on what to do with it at least.
Yeah, that was something I was noticing looking through these things. Just the especially with the AIDS in the 80s, it seemed like we didn't have as a society a very good grip on exactly, you know, how viruses worked and what was dangerous and things of that nature. Because a lot of the posters, you know, just things, these ones I was showing with the bug bites, and you know, you can play with kids who have AIDS and it's not going to get you sick, and that sort of stuff seems, you know, almost silly at this point when we know, because there's been so much research done into it and so much public information went out. I mean, I think many of us grew up during that time. I know I did. And, you know, I was fairly little when the really scary part of this was out. But I remember in school talking about it and all the things that go along with it. So, and it seems with the Ebola that I think maybe it's just my frame of mind. I think we, as a society, were a little bit more aware of exactly, you know, like that poster said, you know, stay 3 meters away and you're going to be fine, even with something so incredibly deadly as Ebola. But so it's interesting that.
Yeah, I just pulled up the well, at least some feature on NEH. I like the subheading here, finding pockets of hope in the great flu epidemic or pandemic. Sorry, which there's some probably debate as to exactly where this one's at, to epidemic versus pandemic, but I like that. I think, at least for me right now, it's like it's sad how quickly we get to the point where it's like, where's the hope? There, you know, humanity, we're all in trouble, which obviously I think that's getting the putting the cart a little ahead of the horse, but at the same time, you know, looking back at something like this, you know, this epidemic and pandemic, it's no joke. Influenza then was a bad situation, but obviously healthcare's at a different place these days too.
I have a technical question to ask. You and Keith are able to share your screens, but how would a whole group be able to share resources that we find with a Google Hangout?
There's a few ways to do it sort of internally here, and then there's also sort of on the event page, which I'm actually going to share this. I have 2 screens, which makes it a lot easier. I know that's not always for everyone, but on the event page too, there's a conversation. You can see this sort of conversation stream that can happen here. So it can happen kind of in a couple places. I think pushing people back to the event page for this is probably where the sort of archive of any links and stuff will end up.
And for Mary and Kathleen, I know you know how to do it, but Kathleen and Cindy, if you're a presenter in one of these, if you kind of put your mouse over to the left side of the screen, there's a little green box with an arrow. That's the screen share tool, and so that's available to any of the people who are presenting. Okay. So if you had a resource you wanted to share, that would be another way as far as the presenter side. And then if you're a participant, like Taylor said, on the event page, and then there's also a tool called, that I think most of us have seen, the Q&A tool as well. That would pop up on, if we were we're not using it for this case because we don't really have an audience, but it would pop up for the users on the right-hand side where they could type in questions.
Yeah, and the thought, I mean, I like having a content focus with these, but I think as big a piece of these is, getting people to feel comfortable getting into the space. So I think these can also, asking questions like that is perfectly fine. Not even, I mean, this is kind of a test run, obviously, but I think in the long run, I think that can kind of be part of kind of how these work. It's like, let's all, get comfortable and feel like we can use the tools that are provided here too. So.
It's for technology.
Any other? I'm wondering about teaching thoughts, maybe bringing technology in, using this juxtaposition of these, then and now sort of media sweeping sort of epidemics that have come into the public facing sort of view. Any thoughts on how to use that then and now sort of thing to have an activity created, a specific piece of technology that might work? Any thoughts from a teaching angle?
I'm not so sure about technology, but one of the most fascinating things I found when I was studying was that the AIDS, the kind of rhetoric you saw in the newspaper, the kind of fear, the kind of, watch out for bug bites, that was all present. By 1880, they know what causes tuberculosis. Koch has isolated the bacillus, but it's really not until almost 1920 before people are getting it. In fact, Colorado Springs, Mary, of course they boosted and they had all these sanatoria and they invited everyone to come, and then all of a sudden they realized it's highly contagious. So they have this. They have a law they're trying to pass is that all tuberculars have to wear bells around their necks, and so it's a social thing because it's social because it's poor tended to get it, but that's the nature of the disease, and the higher incidence of African Americans after the Civil War. But then you have this whole group of people like Bella Bartok and Byron and Shelley and I think Keats, I can't remember, but anyhow, so all of these super creative people. So it was like either you're poor and you get it or you're super creative and you get it. But the interesting thing was that the reports of deaths never called it TB. They called it consumption or weak lungs or whatever. And when you look at the obituaries of and they did that for stigma, and they did that for insurance because insurance wouldn't pay off. And so when you look at the obituaries of in 1980s, what are they using? They're talking about people dying from TB. So by 1980, it's better to die of TB than admit you died of AIDS, even though AIDS was the initial cause that precipitated the death by tuberculosis. So there's a lot of, I think that, there's a lot that you can talk with kids about that they can understand that some things don't change, or there's social stigma attached. I mean, it was poor. That was the social stigma, that you were somehow unclean and poor in the 19th century, and of course in the 20th century with AIDS, you're gay. But I find it just so interesting. I love your topic, Keith.
Yeah, and I see some correlations here. I mean, like very recently in the news, you're seeing issues like that there's states are quarantining healthcare workers who are coming back from Africa and the infected areas, and whether that's a good or bad thing, and the stigma that's being hung on these healthcare workers, and the fears that this is going to prevent people from wanting to go over and help because they don't want to be stigmatized with this stuff and being quarantined. And so, very, very interesting correlation between the issues over time.
There's a sort of global aspect now with Ebola that it'd be interesting to look back and see what sort of resources you could pull together that showed that same sort of, we're sort of localizing this to an African-based or originated sort of issue. And is that part of the times that obviously we're just functioning sort of as a global society now, or was there that similar sort of looking outside the U.S. back, whether it be TB or anything else? And I know, Cindy, you probably have thoughts on some of that. I don't have the actual historic background on it, but I think bringing in that sort of global perspective is
well. In the 1990s, there's a resurgence of TB because they don't test for it anymore, and so among the first people who come back with active cases, and especially with the drug-resistant, they come on airplanes. So one of the first people ended up in Atlanta in quarantine. And so then there becomes this whole thing about, especially with AIDS people who've now contracted TB and are given, they had drugs, but wouldn't do the whole course of drugs. So of course then the bacillus mutates. So there's a whole big discussion about your rights. I mean, they were talking about, in Boston in particular, quarantining these people and putting them in, and not jail per se, but that kind of a thing, to make sure that they did take the full course, because if they spread the mutated bacillus, there was no way to cure it, at least at that time. So it's, yeah, it's cyclical. It's fascinating.
I'm thinking of teaching strategies for these kinds of visuals that Keith was showing us. And I'm thinking that if you start with student questions and you give them a few items to look at, but then they start identifying other epidemics, even the polio epidemic and others throughout history, and then they find similarities and differences in the messaging that came out of each of those situations. And then maybe they end up creating a poster for Ebola information or a current threat. And so they're thinking in terms of public health and what the public health people are responsible for, and they can create something based on all of the knowledge that they gain through their research. That would be just one teaching idea.
Yeah, what's the message based on? I mean, that'd be, you could get into some serious research, but how does the message actually change based on, these bigger, social threats in health? Sort of looking back historically, I think that'd be really cool. You could probably draw some interesting correlations between how the message got pushed out, both based on the actual timing, or actually based on how the disease was either spreading or how it originated, the actual pathology of it. More than I have time to do, but. Any other last thoughts? I want to keep it. I know we really want to try to keep these fairly short. Any final thoughts from anyone before we move on?
Well, I mean, this is, I don't know that it could be a teaching idea, but it's certainly a conversation we had over the weekend, which is how interesting that the federal response versus the state response to quarantining the healthcare workers coming back from West Africa, and if it, like, the thing that I kept thinking of, instead of coming to a rash decision on the New York and the New Jersey governor at the time saying that they want to quarantine every returning worker, was if you put that in the hands of a student, what would you do? You have a commonwealth, or you have a state filled with citizens that you have to think about the entire group versus the rights of the individual, and then yet you take away, in such a stark way, you take away the civil liberties of an individual for the safety of, and so I just think, like, how interesting it would be to have that as a debate, in trying to, and then in thinking about historical ways, like, because I the one thing that I want to share, Keith, is that I too also had that same reaction that I can remember in the 80s when AIDS, really, people didn't have a clue. I was working in a hospital, and a county hospital, which was kind of a last resort hospital, doing inventory for a company, and I had to go into, and it mostly was seniors that lived there who were at the end of their lives, and I had to go into a room, and I saw a young patient, and I had to go into the room. They wouldn't let me. I had to go head to toe, completely covered, because the patient had AIDS. And they put me in a mask. I was in gloves, and just to go tag a bed. I was mortified, and I didn't know, but it was the first young person that I had seen, and I knew that it existed, but I didn't know anybody who had it, and that was my first interaction with somebody who had AIDS, and I knew it wasn't right, but then that was the only way I could get into the room, which was to do it. And I kept thinking, like, that was such an overreaction, right? But it was, at that hospital at that time, was the best way they knew how to keep other people safe, I guess. I don't know. I was young enough that I didn't have all the information, but I don't know. I just think it's an interesting predicament, and what historically has happened through the years. I think it's very worthwhile in bringing it towards the debate issue as well.
Yeah, I think that's a perfect. I mean, the idea here is to get some ideas on the table, and in the long run, hopefully gets an audience of teachers that they're really going to put this sort of stuff into action, and again debate whether there's compare and contrast. There's so many ideas. I think I know most of you, and certainly teachers could talk at length about these sorts of topics. So I'm hoping we can do these on a fairly regular basis.
That's great.
And yeah, just get a few ideas, kind of chum the water a little bit, and then hopefully get a small audience that can pick them up and run with it, and then extend conversations once something gets taught. Hopefully, maybe bring it back into the space in Google or in the TPS Teachers Network, wherever it might be, and tie that back together to keep the conversation going. So
I have to say though, Taylor, that this conversation is far richer than a one teacher, one classroom conversation, because we have experiences, actual experiences from Kathy and from Cindy's research, experiences with epidemics and with fear, the fear of those, and that adds to the richness of the conversation that you wouldn't get from just a single teacher telling a story or two.
Yeah, and these are going to become fairly available, and I don't see any reason, and hopefully, the people that present, like yourselves, are okay with the fact that maybe this becomes sort of a teaching tool in some way. You might open an activity or a lesson or something using this video and showing some those we saw it in a previous one, those real sort of life experiences from the Veterans History Project, and now what you just said, Kathy. It's like that's what really brings the power to being able to sit and talk is feeling the sort of empathetic piece come through from people that have experiences from it. So
well, and if you show that picture, the "Don't Kiss Me, the Baby" picture, and just ask kids, I'm thinking particularly middle school kids, why wouldn't you kiss a baby? I mean, that's so counterintuitive.
Yeah.
That's a hook right there that begins some chatting.
Yeah. That looks like such a kissable baby, doesn't it?
Yes, I know.
Like the Gerber baby.
Yes.
All right. Well, thank you all very much for putting in this half hour. And again, I'm not sure who will actually be the end audience of this, but I want to make it known that there wasn't any real planning that went into this. It felt okay from your perspective, being presenters, that there wasn't any sort of planning. Keith obviously pulled together a few sources to sort of start the conversation, but the hope is that we're open to having these sorts of dialogues and this kind of discourse around what the library has, what technology can bring to the conversation, and do these on a fairly frequent basis with all the great. Again, we have such a great sort of wealth of knowledge across the country in TPS. So hopefully we can gain a lot of that and archive them, and build a bigger picture around what's possible with technology and primary sources. So thank you all for being here, and hopefully you thank us for not having to plan much. Sometimes these become big, difficult things to become a part of, and those, again, we're having conversations around that. What the best way to go about it is, but this is one approach. Very minimal planning went into it.
Well, it was great. I enjoyed it, and I appreciate you trying. I mean, this is what we're all here to do, is to try this on for size, and I like it. It just wet my whistle, and I wish I had some time to do some research. So I thank you for the topic too.
Yes, yeah. Thank you. Good to see you, Mary.
You too, Cindy, long lost friend.
It's easy when we all know each other too. That helps. Yeah, thanks for kind of starting things off, Keith. That was, I think, that's the idea behind the content. That was a very easy topic to discuss given the times.
Yep. Thanks everybody for kind of indulging our crazy idea and bringing your knowledge to the table. It really kind of made for rich conversation. So thank you.
All right, guys, I got to go. Thank you.
Next time.
Bye,
Thank you.
everybody.
Bye.